Welcome back, Gadgeteers. Today we're going to talk about an issue that I think is particularly egregious, and I don't usually use that word. So in this case, this is something that I would consider egregious. Now, most of you probably don't know, but at one point I was working on my PhD before my health started to go downhill, and my area of expertise is security and information assurance and information technology. And I've learned quite a lot along the way with my personal experience, my work experience, and my education. And when this particular story came up about Facebook, I was horrifically appalled. Now, just to set the stage, I am not talking about the story regarding Facebook and Cambria Analytical. You may have heard of that story. So, on a regular occasion, Facebook will allow companies access to their extremely large volume of data about users and their habits and their political leanings and so on and so forth. And this information typically will be used by other companies and then analyzed and turned into useful information for people like Donald Trump and his organization when he was running for president. So that in itself is a problem, and the fact that 87 million users' data was siphoned. But that isn't the story I'm going to talk about today. That one was bad enough. If you haven't heard, it's horrifying. The worst thing about this story is the fact that Facebook admitted that it was done and did not consider it a data breach. So they didn't think they had to alert anybody. And the fact is, it wasn't a data breach. A data breach is something when an individual or an organization or a government gets access to data illegally without permission. In this case, this company had permission, and it's egg on Facebook's face. Wow, that's a full line right there. Egg on Facebook's face. Anyway, it's not even the fact that Facebook was collecting call logs of Android users and information about who they were talking to, which is horrific in and of itself. No, that's not the story I'm talking about either. Those two issues are big with Facebook, and they should give everybody pause for concern when they're sharing their private information. And I know all of us, or a majority of us, are probably on Facebook. I have a Facebook page for FastGadgets, and I have a personal page as well. But this entire situation has made me rethink it. So let's talk about the big story. And this one is not getting a whole lot of news. I only saw it in one place. And this story is that Facebook is looking to collect your personal health information about you. Now, this is positively horrifying, and we're going to go through and have a look at this entire story and dissect it. But here's what's basically going on. Facebook sent doctors, now they say a doctor, but it was probably a team, not just a doctor, but other people. They were in talks with hospitals and medical groups just last month to propose sharing data about social networks of their most vulnerable or physically or mentally ill patients. They wanted to build profiles of people that included their medical condition and health systems that health systems have, as well as their social and economic information. That right there is cause for concern. I'm going to explain why I think that. But let's go on before we do that. Facebook said the project was put on hiatus, and you know why, because lately they've had quite a falling out with the public with the previous two issues we talked about. So Facebook had asked several major U.S. hospitals to share anonymized data about their patients, such as illnesses, prescription info, or whatever, and it was supposedly for a proposed research project. They were intending to match it up. Facebook was intending to match up the user data it had collected and help the hospitals figure out which patients might need special care or treatment. The proposal never went past the planning phases, but was put on pause after the Cambridge Analytica data leak scandal. Here's the scary part. While the data would obscure personally identifiable information such as the patient's name, Facebook proposed using a common computer science technique called hashing to match individuals who existed in both sets. Facebook says the data would have been used only for research conducted by the medical community. The project could have raised new concerns about a massive amount of data Facebook collects about its users and how this data could be used in ways users never expected. And this is creepy. It kind of reminds me of Area 51. Facebook has its own place similar to that, where they engage in interesting top secret data collection called Building 8. The exploratory effort to share medically related data was led by an interventional cardiologist called Freddie Abernussi, who describes his role on LinkedIn as leading top secret projects. It was under the purview of Regina Dugan, the head of Facebook's Building 8 Experiment Projects Group, before she left in October 2017. Facebook's pitch, according to two people who heard it and is familiar with the project, was to combine what a health system knew about its patients, such as person had heart disease, age, medications, trips to the hospital, with what Facebook knows. User is age 50, married with 3 kids, English isn't a primary language, and so on. Here is the so-called benevolent work that Facebook was trying to complete. The project would then figure out if this combined information could improve patient care, initially with a focus on cardiovascular health. For instance, if Facebook could determine that an elderly patient doesn't have many nearby close friends or much community support, the health system might decide to send over a nurse to check in after major surgery. So basically, Facebook is saying that their collection of this information is completely benevolent and only for the greater good of its community of users. The problem we have here is, one, your private information about you, because it's been stripped of your actual name and address and directly identifiable information, has essentially been turned into information that is in aggregate. So it's really not supposed to be personally identifiable. But what the article says is they're going to use hashing techniques, and it's far more sophisticated than that, of course. But the accuracy with which they can match the information from the hospital with the information from Facebook is unprecedented. Facebook is very, very good at matching data. That's what they do. And they would collect this health information about you that should remain private and have that information. Now, Facebook says it's going to use it for this purpose of helping you and work towards goals of, improving your overall health in whether it's mental or physical, and promote your general well-being. However, number one, if we're skirting around HIPAA law by using non-personally identifiable aspects of your health data, then giving it to Facebook, so we've skirted around the HIPAA law, and then Facebook can figure out how to link it to you, what's to stop Facebook from using that content, that information that they've collected about you, and selling it to a third-party company, just like they did with Cambridge Analytica? I think that if Facebook hadn't been caught doing what they were doing, they would have continued doing it, and they would have done this particular project. And although it initially would have started out as again, benevolent and innocent, I think it would have been greatly expanded quickly. And keep in mind, when you go to a hospital, many times these hospitals are actually connected to a giant organization that actually owns more than one hospital. In my case, our local hospital here that's closest to me is Genesis. And Genesis is actually a part of a huge network of hospitals throughout the United States that are all owned by the same company. That's food for thought. So approaching these organizations, not just hospitals, but health organizations that have all this information collected in one data repository is very concerning. And then giving that information to a private company for what purportedly is research intentions makes me very, 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 very concerned. And I think you should be too. Let's talk about what we can do about this. What are some of the things we can do? Well, can we delete our profile on Facebook? Yes. Will the information they've already collected about you be deleted? No, I don't think it would. Now, I haven't tried to delete my profile, so I have a dummy account set up. At some point, I'll go through and attempt to delete it. But would we ever know that that information was ever deleted? If you've watched my videos before, as an information technology person, I've talked quite a bit about why delete anything. Remember, storage is getting cheaper and cheaper and cheaper, and it's more available in larger quantities. When you buy a server, the base storage is enormous as it is, and Facebook knows about managing and storing data. Now, why would they delete anything when they have information? It doesn't make any sense. They're not going to delete your profile data. I think they will delete your access to it and the front end, so you can't see it on Facebook, of course. And I think that they will have that information about you, and it will still be there. That's one thing. So you could delete your profile. I doubt it would help as much as you would think. The one way it would help is you would no longer be providing any more data to Facebook to analyze and collect and sell about you and your family, if you think about it. Even if you have minors, you have children that are on your Facebook account, you talk about them, you show pictures, you talk about their age, their birthdays, all of that information they collect and store. So it's not just about you, it's about your family as well. Think about that. Also, networks. And Facebook knows about people you could network to but don't network to. So their information about you is vast. And I say information because it's not just data. They didn't just collect data, they actually turned it into useful information for them, right? So they can understand more about you. You could reduce the amount of information that you provide to Facebook. Many of us say, well, I can't leave Facebook because all my family members are there, and if I leave Facebook, how will I connect with them? Well, there is that, but you have to remember that you literally are the product. So anything you provide is information that can zero in on you as an individual and your family and your network of people that you know and your habits and what you do and how you do what you do. So it's kind of scary. So you could reduce information that you provide about you as an individual. Would that help? Probably not. I hate to say it. What else could you do? Go through the privacy settings in Facebook. One of the things Facebook is not really doing very well is making privacy settings that restrict access to your personally identifiable information, or any information about you for that matter, to Facebook. They will help you restrict your information and help you make your information more private to your friends, the public, connections, right? Friends of friends, and so on. But not necessarily to Facebook themselves, because again, you are the product. So adjusting your Facebook privacy settings may have a very limited impact on what information Facebook collects. I'm going to go with limited or no impact on the information that Facebook collects. So if you're really concerned about this, as you should be, I would say that the best bet is to delete your profile. Are many people going to do that? I'm going to go with no. Now, I posted this story on my personal Facebook account, and only one person liked it, and that was a student of mine that was involved in my information technology program at one of the colleges that I taught at. And that person definitely understands the value of information and how insidious this is for Facebook to be doing this. Now, some of you may say, well, Facebook could link data from a health perspective, from a health organization with their information, and through this hashing actually do a link that's not a correct link and link me with health information that is not mine, so I don't really care. Okay, I grant that that could happen. Now let's think about that for a minute. Facebook collects information about you. They link you to health information that isn't correct. And we can't speculate what that information might provide, but it's wrong. And Facebook then in turn sells that information to other parties. And we don't know how those other parties are going to use that information and what they're going to do with it. This in turn is the problem. So if it's correct, it's bad. If it's not correct, it's bad. Assumptions may be made about you that are completely incorrect. So a bias could be entered about you from this company that's receiving this information about you. I hate to think of this, but I could imagine where a company, a large company say, purchases this information to make a determination on hiring you. So they do a background check and they pull this information and they say, this person has an illness, we're not going to hire them. We can sit here and say, yes, but that's completely illegal. That'll never happen. But I would have thought that any of our health information, even that which is not directly identifiable to us, would have been sold. And I say sold because I can't imagine that these hospitals are just handing this information over. These health information networks, these companies are just handing this information over out of posterity on the hope that it might help them work with their customers better. Now, nothing in the article says that Facebook is actually paying for this information. It's just hard for me to believe that cash-strapped hospitals that are getting killed by the insurance premiums and the cost of insurance that's going up and the cost of healthcare in general and trying to cut corners in every way, shape, and form is now willing to provide patient information considering the fertility of the ground for lawsuits. I can't imagine that. So it's very concerning to me. And I think that what we can do, if we're not willing to delete our Facebook accounts, I think we have a reasonable expectation to privacy and a reasonable expectation that this wall is there between our healthcare information and our personal information on Facebook about our families and, things that we do and habits and lifestyles and so on. And this wall is dropping, and that information could be, now according to what we see here, Facebook has stopped and they're not going to continue with this program. But they didn't say that. Remember, they said it was on hiatus. And that word specifically, if you think about it, means for some period of time, they're not going to pursue this. That's what concerns me, and that's why I bring it to you now. So the number one thing that I think you can do, and I will link this article in the description of this video, is to read the article yourself, share it on your Facebook if you have one, and say, I'm very concerned about this. I do not want my information my health information linked with my Facebook account. This is just wrong in so many ways. So anyway, I thought I'd bring it to you and see what you thought, considering Facebook's recent abuse of power, which is really what's happening here. This particular situation to me is the absolute worst, to actually be trying to do this, to link our health information to our Facebook private information. I hope you enjoyed this video. If you did, like and subscribe. And please do share. Now, I did look at my statistics and I see that I'm getting quite a bit of shares, and I really do appreciate that. And I also appreciate your views as well as your comments. And I've gotten quite a few comments on my videos recently, and I really enjoy reading them, and I do try to respond directly to as many as I can. So keep the comments coming. I always like to see them. As always, thank you for watching, and I'll see you next time on Fast Gadgets. This video was made possible with support from viewers like you. If you find this video useful, consider becoming a patron for as little as $1 a month at patreon.com/FastGadgets.